So this is the very first question over here. Okay, so when it comes to listening and reading, it is very important that you understand medical vocabulary. All right, so since every one of you are medical professionals, this should be something that is a core skill. Okay, so this is the question. A patient says, ever since I started the medication, I have felt constantly dizzy and lightheaded. Okay, constantly dizzy and lightheaded. What term is most appropriate to describe this side effect? A, B, C, or D? So if you know the answer, you can just type it in the chat box. Dizzy and lightheaded. So what will we call that side effect? Right. So we have everyone going with answer option B. Right. The answer option B is the right answer. Vertigo. Okay. So vertigo is where when a person feels like their head is spinning, okay, and they lose balance. Okay. People with vertigo, they usually struggle with balance. Right. Because that alignment is not there in their body. All right. So now let's go to the second question of the day. So that is medical vocabulary. Now let's take a look into the second question. Right, so we have Raki over here as well. Hi, Raki, good evening. Right. So this is the second question. Good evening. Identifying the writer's attitude. All right, attitude of the writer. Okay, so reading part C skill. So this is the text over here. While remote consultations offer convenience, critics argue that they compromise the personal connection between patient and practitioner. So, your duty over here is to find what is the attitude of the writer towards remote consultations. Hi, Murli, good evening. Thank you for logging in.
I'm listening.
So, there's a third question over here. Remote. Remote means what? Online. What is the attitude of the writer? So think very clearly, especially in reading part C, the skill is very important. Identifying the attitude of the writer. So regarding remote consultations, what is the attitude of the writer? While remote consultations offer convenience, so that is a positive information, critics argue that they compromise, means that it comes at a sacrifice. Okay, compromise basically means it is sacrificing. It is sacrificing personal connection between patient and practitioner. So see, when a patient and a practitioner is speaking online, that personal connection is being sacrificed. Okay, even though it is convenient. So what will be the answer? What is the attitude of the writer over here? Supportive, opposed, balanced, or indifferent? So mistaken. I'll give you 5 seconds more. All right. So the correct answer is C, balanced with concern. Okay. Indifferent will not be the right answer. Indifferent basically means having no feelings. Okay. So for example, if you see a stranger, you have no feelings to a stranger, right? You don't have any positive emotions or you don't have any negative emotions. It is not even neutral as well. Okay, that is what we call as indifferent. That is completely ignoring someone. Okay, neglecting someone. That is the meaning of indifference. Okay, so but over here you can see the writer is saying the positive is there. Okay, remote consultations offer convenience. Okay, so if a patient is unable to walk, let's say the patient is having a fracture, the patient is unable to walk, so the patient can actually log into an online session okay, and have a remote consultation. Okay. But the critics are arguing, okay, even though it is convenient, okay, the writer is saying it compromises personal connection. That is, it sacrifices the connection, the rapport that we build between a patient and a doctor. Okay, so here the right answer option will be C option, that is balanced, okay, with concerns. That is, he's having a very balanced approach. He's supporting it, but at the same time, he has some concerns. That is this thing. Okay, that will be the correct answer. Okay, so good job. Nicely done. Now let's take a look into the third question over here. Okay, so understanding the attitude of the writer is very, very important. Okay, so even in listening also. Right, so this is the third question for the day. Understanding figurative language. Right, so this is advanced level skill. In a discharge summary, the patient turned the corner. What does this mean? Figurative language basically means opposite of reality. So the patient did not actually turn a corner. Okay. There is no corner, there is no turning in real life, but to express a message, we use figurative language. So what does the phrase, the patient turned the corner, most likely mean? Okay, so we have C option, we have A option. All right. Put in some effort. Okay, so we have C and A going on. Right, so the right answer option is basically C. Okay, C. Okay, so no problem. Okay, so the A. Okay, so A also we can choose. Okay, but you have to give importance to the phrase over here. Now you see, the patient turned the corner. Okay, the patient. Now let's talk about what turn the corner means. Turn the corner basically means, it is an idiom. It basically means someone started improving after a difficult period. Okay, that is a sudden shift. Okay, so after a difficult time, okay, they showed some kind of an improvement. Okay, that is, we can say it changed. Okay, so it is a positive change. Usually for a positive change, we use this word. Okay, now anyway, you see over here in answer option A, we have the word condition over here. Okay, so here in this phrase over here, the word condition is not mentioned. Only the patient is mentioned. If they had written the patient's condition turned the corner, okay, here the patient's condition turned the corner, yes, then to a certain extent you can choose answer option A. The patient's condition was suddenly, that is, there came a sudden negative shift. Okay, but here the keyword is condition. Here the keyword is patient. Okay, so therefore, for that reason, answer option A cannot be chosen. Okay, so over here, okay, the patient began to recover. Now see, the patient was very sick, okay, in the sick, and now the patient has started to change. It is a positive change. It is a recovery that is happening. So it is a improvement that the patient is showing after a difficult time. Okay, so here, see here the focus is on the patient only. So therefore, C will be the most appropriate answer. All right. Now let's take a look into the fourth question. Yeah. Predicting the missing information. This will help you in listening part A. The doctor is saying, we will need to keep a close eye on your blood pressure. I will prescribe you something to help lower it. It is called. So close eye is an expression. BP. What will be the answer over here? What is likely the missing word? Yeah, right. So what is the patient doing? The patient is trying to lower the patient's blood pressure. Okay, so for that, the right answer option will obviously be antihypertensive. Right. So here it is very easy to eliminate the other three options, right? So that is the correct answer. So now let's go to the last question of the day. Recognizing emotive language. Okay, so this will help you in reading. Okay, usually in reading, this will help you. That is by reading a sentence, you must be able to see if there is any emotion that is being expressed by the writer. So we have A, B, C, and D. Your duty is to find which of the following phrases contains emotive language. Emotive language means words that expresses emotion. It can be positive, it can be negative. Right. So we have everyone going with answer option C. So the right answer is option C, right? The tragic loss. Now you see over here, tragic. So what is the emotion over there? It's a negative emotion. Oh, he's expressing sadness. Okay. The tragic loss of the patient was devastating for the family. Means it was very, very difficult time for the family. Right. So over here, you can see the words tragic and devastating appeal to emotions, key features of emotive language. Okay, so some questions, okay, especially attitude type questions, opinion type questions and all, they will ask you to identify, you know, what the patient is, I mean, what the writer is feeling. So in those type of questions, if you're able to identify the emotive words, it becomes easier, right? All right, so good, nicely done. So today we will be discussing about the OET listening part C, right? So let's talk about listening part C. You know, listening is usually the most challenging. So I personally feel among all the four modules, listening is the most challenging, and that is the reason why listening is the very first exam. Okay, the very first exam is the listening test. If listening is the last exam of the day, then no one will clear the OET, because after doing reading, writing, and speaking, and then if you're doing listening, it is very difficult. So for listening, we need a very active and a very sharp brain, right? So let's have a small introduction to listening part C. Okay, those who are relatively new to the sessions over here. So listening part C of the OET assesses your ability. Now see over here, first and foremost, you need to understand that OET is not testing whether you know English or whether you speak English. Okay, so that is a really misunderstanding or misconception that students have. Okay, you as a medical professional, okay, a businessman or an engineer who speaks very good English, they cannot pass the OET. Why? Because the OET is not testing their language skills. The OET is testing certain abilities that only a medical professional will have. Right. So you need to understand this, and therefore you need to build the skills that is necessary. So this is where that expert guidance will definitely help you. Right. So when it comes to OET listening part C, okay, here the part C of the OET is assessing your ability. Okay. So let's see what abilities are being assessed. Following a long conversation or presentation between or by healthcare professionals. Okay, so presentation means what? Just one person speaking. Okay, only one person is speaking is what we call as a presentation. So sometimes you will be hearing a 5 minute long audio, and a medical expert, maybe a doctor or maybe a scientist, will be talking about one particular medical topic for 5 minutes. And you must be able to follow. Okay, you must be able to track the entire audio. Sometimes it will not be a presentation, it will be an interview. Okay, it will be an interview. Interview basically means what? It is a conversation between a healthcare expert and an interviewer. There also, you need to be able to follow the conversation. Okay. Next is understanding the opinions, attitudes, and implications. So just by listening the audio, you must be able to justify, okay, this is the opinion, this is the attitude, this is the suggestion, this is the perspective, this is the point of view, this is the implied meaning. Okay, that is, they will not directly say, but even they are not directly talking, coming to the point, you must be able to understand, yeah, this is the message that they are trying to say. Okay, that is what we call as implications. And just by hearing it just one single time, you must be able to decode that information. Right. Next comes deal with advanced vocabulary. Okay, dealing with advanced vocabulary, accents, and indirect communication. Okay, so let's see what that means. Okay, now as you can see over here, medical professionals have need certain vocabulary. Okay, so understanding that vocabulary. Now, obviously, the Western accents. So usually British accent and Australian accent and American accents. Sometimes the Scottish accent. Okay, very rarely I have come across Scottish accents as well. Okay, you have to be able to deal with those accents as well, and indirect communication. So indirect communication basically means implications. So in my personal experience, the most difficult accent is usually the Australian accent. Okay, the American accent and the British accent is relatively straightforward because we watch a lot of American movies and British movies, and India is a British colony as well, right? So therefore, British and English American language is little bit easier, but unfortunately, this Australian accent is slightly tricky. Okay, so if you are a person who struggles with the Australian accent, then just watch Australian medical interviews and podcasts and all that. It might help you out. Okay, so in OET Reading Part C, you will be hearing two long extracts. Each will be 5 minutes long, and there will be six multiple choice questions per extract, so total 12. Okay, now what are the skills? Now, as I told you, your abilities are being tested. Okay, so what skills do you need to get maximum scores in Part C? First and foremost, active listening skill for gist. Gist means the overall idea. Okay, the overall message, that is what we call as the gist of the message. Okay, gist and attitude. Okay, you must actively listen. You must not actively listen for the English words, not only the words and sentences, but the implied meaning. Okay, the gist of the message, the overall meaning of the message. Next is inference and interpretation. Inference basically means coming to your own conclusion. Okay, that is when you hear an audio, you must be able to come to your own conclusion. Okay, so this is the, what you call it, the ultimate message. Okay, this is the overall message that the person or this particular extract is trying to say. Okay, like that. Again, they will not say it directly. Inference basically means, as I told you, they will not say it directly. You have to listen to it, you have to understand it, and then you need to come to your own conclusion. So even though there is no direct statements, you must be able to understand this is the implied meaning. Next is identifying purpose and tone. Purpose. Purpose means why. WHY. Um, Right. Purpose basically means why. Okay. Understanding why something is said. Okay. Now you see over here, sometimes the speaker, when they are talking in a conversation or when they are saying something, there will be a reason why they are saying that. Sometimes they may want to warn a person. So, for example, I'm saying a statement, okay, but I'm saying it not simply to inform them, okay, I'm saying to warn them, sometimes to reassure them, to criticize them. Okay, so you need to understand that the tone. So, just by listening to the tone, okay, the happy tone, the, so negative tone, whatever it is, you must be able to understand why this particular information was said. Okay, so that skill also is necessary. Recognizing changes. Okay, so sometimes very quickly they will change topics, and also, from a very positive statement to a negative statement, they will suddenly change. A sudden shift will happen. Okay, so for that we have certain contrast phrases. Okay, so that we will be teaching you later on. And very, very importantly, managing cognitive load. Cognitive means your brain function. Okay. Now in OET listening, as I told you, the reason why the OET listening is the most difficult is because you are doing multiple things at the same time. See, for example, you have to listen to the audio. As you're listening to the audio, you have to read the questions as well. Okay. And as you're listening and reading the questions, you have to choose the correct answer. Okay. And everything you have to do under pressure. Okay. You are not in a very comfortable state of mind. Okay. You have to do it under a pressured, high pressure situation. And you need to keep yourself calm and composed. Okay. Focused. As you can see over here, all these things simultaneously you're doing for almost 40 minutes continuously with no rest. Okay. So there is a lot of mental overload that is happening, and you must train yourself to be able to manage that. So that is another skill. Now see, these are the skills that a medical professional should have. Now there are different types of questions. Okay, so this and all will be talking one by one in the coming on classes. So there will be opinion based questions, that is what. Okay, so here opinion means what the speaker is thinking or feeling. Purpose based. Purpose basically means why. What is the reason why the speaker is saying this? Okay. Inference. Inference basically means coming to your own conclusion. Okay. So they will not directly say it, but just by listening to it, you must be able to understand, okay, this is the implied meaning. Then there will be direct questions. Direct questions are usually detailed specific questions. Okay. What specific point does the speaker make? A fact. Okay. They will say, ask you what fact was said by the speaker. Then you obviously you can also get attitude type questions. Okay, that is what is the speaker's mood, okay, or stance. Okay, again, is it a warning, is it a reassurance? Okay, those type of questions also will be there. And during conversations, so when you are listening to conversations, whether there is an agreement or disagreement between two people. Okay, so there will be two speakers, right? So between these two speakers, usually this is in listening part B. Okay, do they have the same viewpoint? Are they agreeing to the same point, or are they disagreeing? Okay, so that skill also is recognized. As you can see over here, these are the types of questions. So once you're able to identify the question type, you can bring in the right strategies. And also if you're able, so see, there are different question types. So there are 6 question types over here. So some of you will be very good in opinion type questions and inference type questions. Some of you will be very good in attitude and agreement questions. Okay, so everyone will have their own strengths and their own weaknesses. So your duty over here is to find what is your strength and what is your weakness. Okay, and if you identify, so for example, if you say, okay, I'm a little bit weak when it comes to detailed specific questions, then you put more effort into that. Okay, and then you repeatedly expose yourself to those type of questions and refine these skills. Okay, so that self-discovery, that self-introspection, that is, you have to discover what works for you by introspecting. That is, you have to reflect. Okay, that honest reflection is necessary. Now, what are some common mistakes that students make? Okay, so when it comes to OET listening part C, there are some common mistakes that students make. So very quickly, let's just cover that. The first is trying to understand every single word. Okay, so when it comes to the OET listening, see, there are only 42 questions. Okay, 42 questions, and the audio is for almost 40 minutes. Okay, 40 minutes audio, and there are only 42 questions. So the answer will not, so there is so many distractors. Okay, so that is, you see, if you're spending each and every second of your time trying to understand each and every word, you will be draining your mental energy. Okay, so instead you must train your mind. You must train your mind on on finding the answer you want. Okay, so that is the thing. So that we will be training you. Okay, so I'll be training you. That is, you have to give priority to the question. So once you prioritize the question, okay, then only that area you need to focus. Okay, so there is no need to focus on the entire audio because you will become very tired and exhausted. So you must know, you must be very selective when and where to focus. Okay, so that is one common mistake that students do. Choosing an option just because you heard the same word. Now, the OET is very cunning. Okay, remember always that the OET people, they really like to misguide you, to mislead you and to trick you. There are a lot of traps in OET. There are brilliant traps in OET. So many students, what they do is when they read the answer options, they will hope, okay, the same word will be repeated in the audio. So just because the same word is repeated in the audio given in the question, they will choose that as the correct answer. But oftentimes, that is a distractor. So yesterday we did some reading questions, right? Usually the correct answer will not even have one single repeating word. But the incorrect words, the incorrect answer options may have the repeating words. Okay, so you have to understand that there are certain distractors. So don't give importance to vocabulary, okay, when you want to choose an answer option, but give importance to meaning. Okay, so this is another mistake that students do. They give importance to the vocabulary and they wait for the same vocabulary. As soon as they hear that, they choose that that's the correct answer. Okay, so that is the incorrect thing to do. Getting stuck on one question and missing the next. Okay, so usually what many students do is they get stuck on one question. So this happens in usually reading part B and all, and even listening in part C. They do one question, they don't get the answer to it, and they will not move on. They will stay in that question. And what happens? The following questions they will be sacrificing. Okay, so you must know when to move forward. Okay, that ability. So if you make a mistake, forgive yourself. Okay, you did not make a mistake on purpose, right? It happened. You tried your best, but still you made a mistake. So there is no problem. There are 42 questions. So you must know when to move on with confidence. That moving on ability is very, very important. Otherwise, you'll be sacrificing all the other questions. Okay, and then misinterpreting the speaker's tone or purpose. Okay, so when the speaker is speaking, we will not be able to identify, okay, what exactly is the speaker's tone. Okay, so you have to, for this, you need to identify, practice identifying tone shifts. Okay, that is from positive to negative, negative to positive. Okay, that with regular practice, you will be identifying. Okay, so not reading the questions before the audio starts. Now, this is the most important, reason why students usually struggle in OET listening, part C and all. So you get 90 seconds time. Okay, they give you, the OET people, they're very kind. Okay, they give you 90 seconds time to read the questions. But students, what they do, they don't utilize the 90 seconds properly. Okay, so they don't utilize the 90 seconds properly. That is, they're not reading the questions, they are not comprehending the questions before the audio starts. And then when the audio is playing, they really struggle. Okay, so always give importance to the questions. Try to comprehend the question even before the audio starts. Okay, like that. Okay, again, train your ears. Okay, so you have to you identify what works for you, what is difficult for you, and then accordingly train your ears through active practice. Okay, so listen to podcasts. For example, if you struggle with the accents and all, once in a while listening to a podcast, medical talks, dialogues in English and all will be very much helpful. Right. So these are certain tips over here that I just wanted to say. So I'll be sharing this document to you later on. Right. So now let's practice with the listening part C question. All right. So again, those who have not yet done an OET listening yet, you may find this little bit challenging. Okay, because you are not yet really familiar with it. Okay, there is a lack of exposure to it. But don't worry, everyone feels little bit perplexed or little bit what's confused, especially the beginning stages of their OET preparation. Okay, so here we are directly coming to the listening part C. Okay, so it is little bit, it may be little bit advanced, but if you find it challenging, don't worry. With practice, with constant repetition, and with commitment from your side, it will become very, very effortless. Okay, it will become manageable. Right. So let's take the question over here. All right, so this is the question. So I will be giving you the correct explanations and discussions and all that. So before that, I just want you to read the 37th question. Okay, so before that, let's just read the instructions over here. You hear a clinical psychiatrist. Okay, so whose voice are we hearing? We are hearing the voice of a psychiatrist whose name is Dr. Anthony Gibbons. Okay, and this person is giving a presentation. Okay, so presentation means what? Only just one person is speaking. Okay, so there is no second person. Only Dr. Anthony is speaking over here. And about what is the person speaking? About the value. Value means importance. The importance of individual patient's experience and stories in medicine. Okay, so about patient experiences, individual patient experiences, and about stories. Okay, patient stories and patient experiences. So regarding that, a psychiatrist is giving a presentation. Okay, so this is the first question over here. Now you see over here, they give you 90 seconds time. Right, they give you 90 seconds time to read the 6 questions over here. So see, this is question number 1, 3 answer options. Okay, so like that, there will be 6 questions over here. So remember when I told you, you have to read and understand the questions properly. Students, the common mistake the students do is they don't give importance to understanding the question during the 90 seconds. They will blindly read it. They will not register any memory of the question to their mind. And when the audio starts to play, they really struggle. So, okay, just before we go into the 37th question, I just want to give you one small tip over here. It is called the investment of time. Right. See, when you get 90 seconds time, it should be an investment. Investment basically means what? Investment means the benefit comes in the future. Okay. So if you're investing some money now, presently you will not get any benefit, but after few years, then the benefit will come. Right. Similarly, when you are spending this 90 seconds time, okay, you must not simply spend that 90 seconds. You must spend it such that it is an investment. Okay, so that after 90 seconds, when the audio starts to play in the future, you will be getting a benefit out of it. Because after the 37th question, they will not say, the OET people will not say, now we are going to the 30th question. Now we are going to 39th question. They will never say that. It will go in one single stretch. Okay, and you have to identify, okay, now the audio from 37, it has gone to 38 to 39. If the student is not utilizing the 90 seconds properly, they will be in the 38th question, and the answer, now the audio will go to the 40th question. The audio will be in the 40th question, but the student will still be in the 30th question. Because why? They did not utilize the 90 seconds properly. Okay, so like this, small tips and all I'll be giving. Right, so read the question over here. This is the 37th question, and then I'll play you the audio and you try to find the answer on your own, and then I will give you the explanation. The time starts now. Okay, so now I'm going to play you the audio. Just give me a second. His colleague had for sent audio script.
Let me begin with a case study sent to me by a colleague who shares my interest in the subject. The study featured a 30-year-old man who was hospitalized for severe panic attacks. He was treated with narcoanalysis, but feeling no relief, turned to alcohol and endured years of depression and social isolation. 4 decades later, he was back in the psychiatric system, but for the first time, he was prescribed the antidepressant Zoloft. 6 weeks later, he was discharged because the panic attacks and depression had disappeared. He lived a full life until his death 19 years later. If the narrative was striking, it was even more so for its inclusion in a medical journal.
All right. So this is the audio script. So I will play the audio once again. Okay. So if you found it slightly challenging, I'll play it just once again. So listen very carefully. Okay. And then you type your answer in the chat box, whether it is A, B, C, or D. And then we will have a discussion about that. Here, the audio script.
Let me begin with a case study sent to me by a colleague who shares my interest in the subject. The study featured a 30-year-old man who was hospitalized for severe panic attacks. He was treated with narcoanalysis, but feeling no relief, turned to alcohol and endured years of depression and social isolation. 4 decades later, he was back in the psychiatric system, but for the first time, he was prescribed the antidepressant Zoloft. 6 weeks later, he was discharged because the panic attacks and depression had disappeared. He lived a full life until his death 19 years later. If the narrative was striking, it was even more so for its inclusion in a medical journal.
All right. So this is the audio script. Okay. So what type of question is this? Okay, this is a question that is asking you to identify the tone, okay, tone or the attitude of the person. Okay, so for example, let's just take this particular document over here once again. Okay, so what are the different types of questions over here? Okay, opinion, purpose, and all that. But over here, this is an attitude or tone type question. Okay, that is what is the speaker's mood, okay, regarding certain things. Okay, attitude. What is the attitude of the speaker? Now you see over here, why is it an attitude type question? Now you see, let's read the question. Now, first and foremost, what we are going to do, we will be comprehending the question. Okay, comprehension of the question is very, very important, because if you do not understand the question, then it is impossible for you to understand the audio. Okay, because only if you understand the question, you know this is what I am looking for. Okay, you have to listen to the audio with an aim. Okay, there is a focus, there is an aim to listening to the audio. And from where will you get that clarity? Okay, that clarity will come only if you understand the question, if you comprehend the question properly. Okay, so comprehension is number one thing. Next is retention. Okay, retention means what? Registering the question's memory to your mind. You must not forget the question. Okay, after you understand it, you must remember it in your mind. Okay, and then with that memory, with that aim, with that focus, you need to listen to the audio. Right. Again, you have to be very focused. There is no need for you to give importance to every single word. Only where you need to be alert, you need to be alert. I'll be teaching you how to do that. And that is how you need to detect the answer. Okay. Detection comes over there. Now, to comprehend the question, obviously, you need to know the keyword analyzing strategy. Okay. So keyword analysis basically means what? Identifying the keywords and linking the keywords together. And when it comes to detecting the correct answer, you must have the elimination strategy. Okay, so here what type of question is it ultimately? It is a multiple choice question. Okay, so you instead of always trying to choose the correct answer, you must train yourself to eliminate the incorrect answer options, and whichever answer option is the most difficult to eliminate, that will be the right answer. Okay, and for that, the verb analysis will help you, right? So this is what these are the basic foundational strategies that you need to have when you're doing your OET listening. Right. So now let's comprehend the question. What is the question asking us? So here the question is this. What impressed Dr. Gibbons about the case study that was sent to him? Okay. So here this is a psychiatrist. Okay. So this psychiatrist received a case study. Someone sent him a case study. Case study means what? About a patient's case study was sent to him. Okay. And the OET is asking you what impressed Dr. Gibbons. Okay. So this is the attitude. So just by listening to the audio, you must be able to identify, okay, this is the, uh, you know, impressing factor, okay, that shows the emotion of this particular person. Okay, so what is answer option A? Answer option A, answer option B, and answer option C. These are all possible things that impressed him. So impress, what is the emotion there? It is a positive emotion. Right. So you must train yourself. Okay, my duty over here is to identify what positive emotion this person felt, what positive attitude this person felt when he was reading this case study of this patient. So, see, now you have that clarity over there. Right. Now, let's take a look into the keywords of the answer options. So, what is the keywords in answer option A? Where it was originally published. Now, before we go further, tell me, what does the word it refer to? Here also, how controversial its contents were, his colleagues' reasons for sending it to him. So very quickly type in the chat box, what does the word it refer to? Because if you don't know what it is, then this is a very difficult question. What does the word it refer to? Doesn't matter if your answer goes wrong. Type in the chat box. Right, very good. The case study. All right. So it is referring to the case study. Right. So over here, where the case study was originally published. Okay. So this case study was published somewhere originally. Okay. The very first, originally means the very first publication. Right. And the location where this was published is what impressed this person. Right. What is answer option B? How controversial its contents were. Controversial means what? Controversies means there is a lot of discussion, there's a lot of debate, okay, there is a lot of argument, okay, it means it is a big talk in society. That is the meaning of controversial. Okay, usually we talk about celebrities and all, or the celebrity said a controversial statement. Okay, there's a lot of debate and argument and all that, right? So the case study, the contents of the case study was very, very controversial, and that is what impressed this particular person. And third one, the his colleagues' reasons for sending it to him. Okay, so the reasons, okay, why? Reasons means what? Why? So his colleagues sent this particular case note for specific reasons, and those reasons basically impressed this person. Okay, so now let's do the verb analysis. So this is what you need to find out. What impressed Dr. Gibbons? So when you're listening to the audio, you have to train yourself. Okay, my duty is to find what impressed this person regarding the case note. Okay, so let's see what were the keywords over here. I mean, what are the verbs over here? Where this thing was originally published. Okay, so over here, the location where this particular thing was published originally, that is what impressed this person. What is the verb in answer option B? How controversial the contents of this case study was. And that is what impressed this person. Right? Now let's talk about answer option C. His colleagues' reasons for sending it to him. Okay, so here the reasons for sending, that is the verb over here. Okay, now the reasons for sending it to him, that is what impressed this person. Now you see, you have little bit more thought clarity, right? So when you're listening to the audio, okay, it becomes easy for you to focus on the answer options and to eliminate. Right. So on your examination days, as I told you, on your examination day, you can interact with the question papers like this. Okay. So with your pencil, underline, highlight, scribble, make some notes and all, that is completely fine. The only place where you need to keep your answer answer paper very neat is this area. Okay. This area, you must keep it very neat because that is where you will be shading the correct answer. Right. So now let's take a look into the audio script. Okay. Now let's take the audio script first, and then we will be talking about that. Right. So one more thing I just forgot to tell you is that, see, when you are listening to an audio, okay, when you are trying to find the answer, when the audio is playing, your eyesight should only be in the answer options. Okay. When you are listening to the audio, when you're trying to find the answer, your eyesight should only be in the answer options. That time, you must not read the question. Okay, when you're listening to the audio, your eyesight should not go to the question, because if your eyesight is going to the question, then you're distracting yourself. Okay, you are supposed to read only the answer options. So you must have a thorough memory of the question. So what is the question's memory over here? What is your duty over here? What impressed this person? That should be thorough in your mind. Okay. And when the audio is playing, you must never look into the question. When the audio is playing, you must only look into the answer options. Right. So that is a very another important tip that I can give you. Now let's take a look into the audio script first, and then we'll play you the audio once again. Right. So here we listen to the audio. So let's just take a look what the audio is saying. Yep. Right. So let me begin with a case study sent to my colleague who shares my interest in the subject. Now you see over here, this is a complete distractor. Okay, so this first sentence over here, it is not giving us anything that we are looking for. See, here you're trying to identify the attitude of the speaker. What impressed this person? Okay, now you see, let me begin with a case study. So this is an introduction sent to me by my colleague, okay, by a colleague who shares my interest in the subject. So there is no impression. Okay. Now the study featured a 30-year-old man. So see, now you're talking about what the case study was. So the case study was about a 30-year-old man who was hospitalized for severe panic attacks. That is also not completely related to the answer. See, your duty over here is what impressed this person. Okay, but here they're only talking about the case study. The attitude about the case study still has not yet been said. So you can be very calm. You can just wait. Okay, so you can tell yourself, okay, the impression is going to come. The impression is what I want. He was treated with narco analysis. Okay, so again, they are talking about what happened in the case study. He was treated with this narco analysis, but feeling no relief. There was no relief. He turned to alcohol and endured years of depression and social isolation. Now, see, they're still talking about the case study. Still, there is no impression about the study. Right. 4 decades later, decade means 10 years. So 4 decades means 40 years. 40 years later, he was back in the psychiatric system. So after 40 years, the patient came back to the psychiatric system. Okay. But for the first time, he was prescribed the antidepressant, Zoloft. Now, for the very first time, he was prescribed this particular medication. Now, still over here, still, what is our duty here? To find what impressed this person about the case study. Still, nothing is coming. Okay. So that is what you need to train yourself to hear. Okay. I need to find what positive emotion does this person have regarding this. Still, we have not yet read. So still, you have to wait for the answer. Okay, so now they're telling 6 weeks later, he was discharged because the panic attacks and depression had disappeared. Okay, 6 weeks later, panic attacks and depression, the symptoms. So he's taking Zoloft. Now it has been disappeared. Now he's saying he lived a full life until his death 19 years later. So the patient died 19 years later and he lived a full life. Full life means he lived a very happy life. Okay, his panic attacks and depression completely disappeared. If the narrative was striking, now you see over here, in the very last end, the narrative means the story. Okay, this case study. Now, what is the key word over here? Striking. Now, striking basically means what? Yeah, it striked me. That is an impression. Now, this word over here is an emotive word. Okay, this word is expressing the emotion of the person. Right. Now, here he is saying, yeah, what impressed? So, this striked me. This impressed me. Now, this is where you have to become alert. Now you have to, okay, yes, now what I'm waiting for has come. Now, in the end, they are saying if the narrative was striking, it was even more so for its inclusion in a medical journal. Okay, inclusion means what? This was added. Okay, so in a medical journal, okay, that is journal means what? An article. Okay, in medical literature. Okay, so this in a very big or in a very famous medical literature, this case study was included, and that is what striked this person. That is what impressed this person. Right. So when you hear that answer, what will be the correct option over here? Now see over here, answer option A, where this case study was originally published. Okay, now see what struck Dr. Gibbons, the publishing. Okay, what struck him was that this case study was published in a medical journal. Okay, so what you can do, you can put a question mark over there. Okay, or you can say, okay, this is what the answer is, because why? What is the verb over here? The verb over here is originally published. And is it, are they saying, is this information mentioned? This information is mentioned. Okay, and is it mentioned to the impression factor? Yes, it is definitely linked to the impression mentioned, because that is what struck this person. Right. Now, let's come to the answer option B. Now, what is the verb over here? The verb over here is how controversial its contents were. Now, again, we have to give importance to the verbs only. Now, see, controversial. Controversial means about this patient. About this patient, there is a lot of debate. There's a lot of argument. There's a lot of discussion. And that is what impressed this person. Now, see over here, did we hear anything or did we read anything about controversial, that this thing was very, very controversial? So many people were talking about it. Nothing was mentioned right like that, right? So since nothing was mentioned regarding controversies of its contents over here, you can eliminate answer option B. Okay, because this verb over here is completely not mentioned. Now, what about answer option C? his colleague's reason for sending it. Now you see over here, what is the verb over here? The reason for sending this thing. Okay, sending this verb, sending this particular case note to the doctor over there. Okay, now the sending alone is mentioned. Now, for example, if you want to give importance only to this over here, sending is mentioned, that is his colleague send it to him, but the reason for sending, okay, that is for this particular reason the colleagues send it to the person, that is not mentioned. Right. So the reasons for sending is not mentioned, and definitely that is not something that impressed this person. Right. So this entire verb is not mentioned over here, and definitely that is not what striked this person. That is not what impressed this person. So you can eliminate B, you can eliminate C, and you are waiting for the impression factor. And as soon as they say this is where it was published in a medical journal, okay, you can choose answer option A as the right answer. Okay. So now what I'm going to do is, now you know the question, you know what you're waiting for, okay, the impression factor. So now once again, I will play you the audio, okay, and this time you see whether you're finding it easier or not. Okay. So what strategies are we using? The strategies we're using is, first of all, identifying the question type. Okay, this is an attitude type question. Okay, so here my duty is to find what attitude, what positive attitude. Okay, what was the positive attitude this person had about this particular case study. So that is the only thing you have to wait for, nothing else. There is no need for you to give importance to the introduction, no need to give importance to the diagnosis of the patient, how the patient got better and all that. Okay, what impressed this person, that you have to wait. And towards the end, they're talking about that, a striking thing, and where about the medical article that was published. And as soon as you hear that, you should be able to suspect A as the correct answer, and you must be able to eliminate B and C because it is not mentioned, and choose answer option A. Okay, so let's play the audio once again, and this time you implement the strategies that I told you, and you see if it is little bit easy this time. Okay, so this is how OET listening and all you have to develop. These are the skills that is necessary. Right. So let's take a look into this one thing once again.
The 30-year-old man.
Here, the audio script.
Let me begin with a case study sent to me by a colleague who shares my interest in the subject. The study featured a 30-year-old man who was hospitalized for severe panic attacks. He was treated with narcoanalysis, but feeling no relief, turned to alcohol and endured years of depression and social isolation. 4 decades later, he was back in the psychiatric system, but for the first time, he was prescribed the antidepressant Zoloft. 6 weeks later, he was discharged because the panic attacks and depression had disappeared. He lived a full life until his death 19 years later. If the narrative was striking, it was even more so for its inclusion in a medical journal.
All right. So this is the audio script. Okay. So now you see, now it is a little bit easier, right? Now towards the end, we have the right answer. See, this is why I have the recorded lectures in the OET Exam Mastery App. Okay. So see, it's I think almost like a 50-minute lecture. Okay. Just to teach you 6 questions, we have a 50-minute lecture available in the OET Exam Mastery App. Okay. So the lectures are very detailed. Okay. They have, what do you call it? Very detailed slides where I talk about explanations why certain answers or answer options are wrong, why certain answer options are correct. In Indian languages also the translations are there. Okay, so if at all you have some doubts related to certain Cambridge University questions, you can just find it in the app. Nowhere else you'll be able to find it. Okay, and you can actually make some notes and improve your skills. Okay, and in the live classes, I'll be giving you the guidance that is necessary, and I'll be clarifying your doubts. So this content from the app is 24/7 available. Utilize that to your advantage, okay? Because that is premium level quality coaching you're getting. Don't, skip on it. Right. So now let's come to the 38th question. So are you ready? Right. So 38th question. First, I want you to read it on your own. right? And then try to find the answer. Give you some time. With images, videos, animations and all. For that visual aspect and all, we have made these slides. So it's going to help you. Okay, so now it's going to play the audio now. Okay, so very quickly just look into the question. Let's hear the audio script.
Repeatedly, I've been surprised by the impact that even lightly sketched case histories can have on readers. In my first book, I wrote about personality and how it might change on medication. My second was concerned with theories of intimacy. Readers, however, often used the books for a different purpose, identifying depression. Regularly, I received and still receive phone calls, people saying, "My husband's just like X," one figure from a clinical example. Other readers wrote to say that they'd recognized themselves. Seeing that they weren't alone gave them hope. Encouragement is another benefit of case description, familiar to us in an age when everyone's writing their biography.
Right. So let's understand that in simpler terms. This is a little bit tough question. Okay, it is not very easy to eliminate the incorrect answer options as well. So once again, I'll play the audio. Okay, and this time also just give some more focus, and then I'll talk to you the right answer. Subtle changes in behavior. Now let's hear the audio script.
Repeatedly, I've been surprised by the impact that even lightly sketched case histories can have on readers. In my first book, I wrote about personality and how it might change on medication. My second was concerned with theories of intimacy. Readers, however, often used the books for a different purpose, identifying depression. Regularly, I received and still receive phone calls, people saying, "My husband's just like X," one figure from a clinical example. Other readers wrote to say that they'd recognized themselves. Seeing that they weren't alone gave them hope. Encouragement is another benefit of case description, familiar to us in an age when everyone's writing their biography.
Right. So let's understand that in simpler terms. Okay, so let's take a look into the question over here. This is, I would say, a medium difficulty question. Not very difficult, but not very easy as well. But I would say medium difficulty. Okay, so let's take a look into the question over here. What type of question is this? Let's understand. Dr. Gibbons has noticed that people who read his books. So here, what did Dr. Gibbons notice? That is what you need to find. Okay, that is what he noticed from people who read his books. So what is answer option A, answer option B, and answer option C? These are things that this person noticed. Okay. So Dr. Gibbons noticed this. Answer option A, he noticed this, he noticed C. Okay. So your duty is what he noticed from the people who read his books. Okay. So that idea you have. Okay. So now let's take a look into the answer options over here. What is answer option A? Gain, so let's do the keyword analysis first, okay? Gain insights into their mental health problems, okay? Now, who is there over here? Who is there? Who is he talking about there over here? Can you say? Can you type in the chat box? Who does the word there refer to? 5 seconds. Yeah, very good. Okay, very nice. The people who read his books. Okay, the readers. Okay, so a little bit more accurate verb will be term will be readers. Okay, readers who read his books. Okay, so now answer option A. He noticed that people who read his books gained insights. Insights basically means knowledge, wisdom. Okay, gained insights. Okay, the knowledge into their mental health problems. Okay, so the people who are reading his books, they had some mental health problems. Okay, they are not very fully 100% normal people. Everyone. So, according to psychology, every one of us is having some degree of some mental conflict. Okay, so people who read his books, they got some additional information. They got some beneficial knowledge about their own mental health problems. Okay, that is what answer option A is telling. So this is what he noticed. Okay, now let's take a look into answer option B. He noticed that people who read his books, they see an improvement in personal relationships. Okay, so the readers over here, they have their own personal relationships. And after reading his books, their personal relationships improved. Okay, so that is what he noticed over here. What is answer option C? He's saying people benefited from a subtle change in behavior. Subtle. Okay, so here the B is silent. The B over here is silent. Subtle. Subtle basically means a very small, a very tiny change. Okay, almost negligible. Okay, or negligible means very, very small, very, very tiny. Okay, so a very small change in behavior happened. Okay, so after reading this book, after reading his books, what happened? They changed their behavior. The people who are reading his books, they changed their behavior, and because of that change, they got some benefit. Okay, so like this, you need to identify the keywords over here. But more importantly, let's identify the verbs. Okay, so over here, your main duty is to find what Dr. Gibbons noticed. Okay, Dr. Gibbons noticed from the people who read his books. The first, what is the verb over here? Gain insights into their mental health problems. So this is the action. Okay, they gained something. And what did they gain over here? They gained knowledge. That is what he noticed. Now, what is the verb in answer option C? See an improvement in personal relationships. So after reading his books, he noticed that people's relationships, personal relationships improved. That is the verb in answer option B. Now, what is the answer option C telling? Benefit from a subtle change in behavior. So this one is a little bit tricky over here. We can say there are two words, benefited from a subtle change. So which should we choose over here? He noticed that, okay, so maybe the benefit. Okay, so I think we can choose both over here. Okay, so there was people changed. Okay, people changed their behavior, and because of that change, they got a benefit, and that benefit is what he noticed. Okay, so like this, you can do the verb analysis, right? So now what you need to do, you need to keep the memory of the question into your mind. So after you have read the question, you have to register the information to your mind. You must not forget the question, because when the audio is playing, your eyesight should only be in the answer options. When the audio is playing, your eyesight should not go into the question, because you will be distracting yourself. Okay, so this is where your eyesight should be. Okay, so now let's identify what question type is this. So what question type is this? So this is a direct question. Okay, a factual information. Okay, they're actually talking about a fact. Okay, I noticed this thing, and this is what you need to this fact. Okay, I noticed this particular fact over here, and that, so this is a direct question. Okay, there is no indirect question over here, so it's a more direct question. So first, let's take a look into the audio script. Okay, so let's take the audio script first. and then we will go to the audio once again. Okay. So remember, what is the question asking you? The question asking you what he noticed from the people who read his books. That should be in your memory. Okay. Now let's take a look into the audio script and then we will play you the audio. Now he's saying, I have been surprised by the impact that even lightly sketched case histories can have on readers. Okay. So here he is saying, okay, he is very surprised by the impact. Impact means what? By the effect, by the consequence, by the effect that case histories can have on people who read his books, on readers. Now he has written two books, right? In his first book, I wrote about personality and how it might change on medication. My second book was concerned with theories of intimacy. Now over here, you see, you don't have to focus on all these statements because why? He is talking about his first book, he is talking about his second book. But what is your duty over here? Your duty is to find, after reading his books, what the people noticed. But here, what is he talking about? He's talking about what type of book he wrote first, what type of book he wrote second. So you just have to wait. You just have to tell yourself the answer is not yet come. Okay, the answer is only going to come. Right. Now let's read the third sentence. Readers. Okay, now the keyword is coming. People who have read his books. Readers, however, often use the books for a different purpose. Okay. Now, how did the readers use his books? Okay. They use the books to identifying depression. Okay. People, they used it for identifying depression. And he's saying, regularly, I received and still receive phone calls. Okay. Now he's saying people, after reading his books, they call him. Okay. He receives so many phone calls and the people say, my husband's just like my ex. One figure from a clinical example. My I mean other readers, now they're talking about other readers as well. Other readers wrote to say that they had recognized themselves. So after reading his books, what is the impact that they're having? They're able to identify their depression. Okay, before reading the books they did not even know they had depression, but after reading his books they are able to identify, oh, I have depression. Okay, and they are also saying they recognize themselves. That is, after reading his books, they are now able to recognize themselves. Okay. And let's now here they are saying, my husband is just like my ex. Okay, that we will come to one specific answer option. We can use that to eliminate one answer option. Anyway, let's continue reading. Seeing that they weren't alone gave them hope. Now you see over here, after reading his books, okay, the people are reading about other patients, right? The people are reading about other patients, about other case studies, and people know, oh, they are not alone. Oh, I am not the only person who's suffering this. There are so many people who are suffering my same problems. Okay, so that gave them hope. The readers have now hope. Encouragement is another benefit. Now you see over here, now they're telling encouragement. People feel encouraged, okay, of case depression, familiar to us in an age where everyone is writing their biography. Now see, in an age means in this time, now everyone over here is writing about their biography. Okay, so everyone is writing only good things about themselves. Okay, in a biography, will we write about bad things? No, we will only write about our successes, right? So when people are only reading about people's successes, they don't feel encouraged. So for example, if you are reading 10 books and all the 10 books are about other people and about their successes, will you feel encouraged? You will compare yourself to them and you will feel, oh, I'm such a failure. Okay, so but when you see a book and in that book there are struggles of people, okay, there are problems of people, and that will encourage you. Oh, I am not the only person with struggles, there are so many other people there. Okay, so that encouragement people get. Okay, so like this, you must be able to decode the information. Now, anyway, let's take a look into the answer options. Okay, so like this, you need to try. Okay, so even if if it is slightly difficult in the beginning stages, you must try to decode. You must be able to understand the gist of the message. That is the training you need to give yourself. Right. So now let's see what and all answer options we can eliminate over here. Okay, so now what is answer option A over here? What is the verb over here? Gain insights. Okay, gain insights into their mental health problems. Okay, now is the uh, verb gain insights mentioned? It is mentioned, right? And what about mental health problems, people's mental health problems? That is also mentioned. So as you can see over here, where is it? Yeah. Yeah. So as you can see over here, gain insights. Now you see over here, readers often use the books for different purpose, identifying depression. So after reading these books, they got knowledge. They were able to identify their own mental health problem. So depression is a mental health problem. They were able to identify. So what does that mean? They were able to gain insights about their depression. So is the keyword mentioned? Is the verb mentioned? Everything is mentioned, right? Now see over here, they recognized themselves. Okay, so what you can do, so when you're listening to the audio, you can put a question mark over here. Yes, okay, the gain insights is mentioned. Okay, so this verb over here, okay, this verb over here is mentioned. This keyword over here is mentioned. So therefore, A could be the correct answer. It is not very easy to eliminate. Right. Now, what do you see in answer option C? What is the verb over here? The verb over here is see an improvement in personal relationships. So what is the verb over here? Improvement. That is, their personal relationships improved after reading the books. But do you think that is what the person is saying? Now see over here. Here the person is saying, after reading his books, people are saying, my husband is just like my toxic ex. Okay, that is after reading his books, their personal relationships are not improving. Their personal relationship is actually, getting destroyed because now they're able to see, oh, my partner is just like my ex. Okay, so can we choose? Can we choose answer option B? Okay, do you think answer option B? Is there anything else? What is the verb in answer option B? An improvement. Okay, but the opposite of that. Okay, so their personal relationships are not improving. People are able to identify the true nature of their husband. It was just like their ex. Okay, so definitely there is no improvement going on. Okay, but personal relationships, is that mentioned? Yeah, to a small extent, the keyword is mentioned. Okay, but the verb is not mentioned. The verb is exactly the opposite. There is no improvement. Actually, it is the opposite of improvement. So what you will do, you will put a question, you can eliminate answer option B. Okay, and you suspect answer option A is the right answer. Now, what is the verb in answer option C? Benefit from a subtle change in behavior. Okay, that is people's. Okay, so this is where it gets a little bit tricky, right? So people started getting benefit. Okay, and why did they get benefit? Because they had a small change in behavior. That is, after reading his books, people changed their behavior, and because of that change in behavior, they got benefit. But if you hear very closely, benefit is mentioned. People are getting benefit after reading his books, but people are not getting benefit because they change their behavior. This keyword, this verb over here is not mentioned. That is, after reading his books, people changed their behavior, and because of that behavioral change, they got the benefit. Okay, so you can eliminate answer option C. Right. So, for example, let's just take the transcript once again. Now, you see over here, do you see, is there anywhere they have written, people change their behavior. And because people change their behavior, they got some benefit. Okay, now see, benefit is mentioned. Now see, this is how they try to trick you. Now see, don't expect the same words to repeat in the answer option and to be in the audio. In the wrong answer options, they will purposefully give you these words. So here, what is they telling? Encouragement is another benefit of case description. Okay, so people are getting benefit because they're able to see that they are not alone. Oh, there are so many other people who are having my same problems, and that encourages them. Okay, but what is answer option C telling? C is telling after reading his books, people change their behavior, and because of that behavioral change, they got benefit. Right. So can we choose answer option C? No, we cannot. Right. So what you can do? You can eliminate C, you can eliminate B, and you suspect that answer option A is the right answer. So A is the answer option, which B is the most difficult to eliminate. And for that reason, answer option A becomes the right answer. Right. Because why? Because all the verbs are mentioned. Gain insights, that is mentioned. Okay. The keyword is mentioned, mental health problems, that is mentioned. Over here, answer option B. What is the verb over here? Improvement. So the opposite of improvement is mentioned. Okay. My husband is just like my ex. Okay. So the personal relationships. Okay. So over here, personal relationships is mentioned, but it is not improving. It is the opposite. So it is decreasing. So for that reason, B is the incorrect answer option. Right? And what about C? Benefit from a subtle change. Now you see over here, is this verb mentioned? Yes, benefit. This verb is definitely mentioned, right? But is this verb mentioned? That is a subtle change in behavior. People change their behavior after reading his books. And because of that, there was a change that is not mentioned. So you will be eliminating answer option C. So this is how you have to refine the elimination strategy. For this, you need to bring in the verb analysis, the keyword analysis, and so forth. And I'm very sorry to say that there are no tricks or shortcuts in OET. Okay, so this is an international examination, and therefore there is no magic trick or that I can give you, so that if you just use that trick, everything, or you will get 42 out of 42. Pure hard work, pure smart work, and pure skill is necessary. Okay, so that's the reason why many students are still writing this exam 8, 9, 10, 11, 12 times. I personally know students who have written the exam 12 times and still they don't even know the basics of OET. That is because the practice methodologies was very wrong. Okay, so there are no tricks over here. This is a very serious examination, and you have to stay very dedicated and committed to the preparation process. Okay, so this is how you have to choose the correct answer. Now, I'll just play you the audio once again. Once again, I'll play you the audio and see if you're able to find the answer a little bit more easily this time. Okay, so let's just take a look into the audio script once again.
Repeatedly, I've been surprised by the impact that even lightly sketched case histories can have on readers. In my first book, I wrote about personality and how it might change on medication. My second was concerned with theories of intimacy. Readers, however, often used the books for a different purpose, identifying depression. Regularly, I received and still receive phone calls, people saying, "My husband's just like X," one figure from a clinical example. Other readers wrote to say that they'd recognized themselves. Seeing that they weren't alone gave them hope. Encouragement is another benefit of case description, familiar to us in an age when everyone's writing their biography.
Right. So let's understand that in simpler terms. Okay. So that is how you will be tackling this. So let's have a small recap of today's session. Okay. So when it comes to the OET reading part C, okay, there will be 90 seconds time for you to read the questions, and you have to utilize the 90 seconds as an investment of time. Okay. So don't rush yourself, hurry yourself through the 90 seconds. Take your time, understand the questions, right? And then when the audio is playing, you have to get a benefit out of it, right? So listening part C, it is either going to be a presentation or an interview. Okay, so here the practice we did, it was a presentation. Okay, just one psychiatrist was speaking. So when you are listening, you're not simply listening to the English. The OET is testing your ability to understand the opinion of the speaker, the attitude of the speaker, and the indirect meanings, implications. Okay, and you also need to be very familiar with advanced medical vocabulary, accents, and indirect communication. There will be 6 multiple choice questions, total 12. Everything goes in one single stretch. Okay, so they will never say 37th question, 30th question, 39th question. You have to stay on track. And there are certain skills you must be able to, even though, see, there is no need for you to understand everything, but you must be able to understand this is the main message. This is the overall message, that the gist of the message that you must be able to sense. Okay, so it is not about understanding the English, but it is about sensing the message. So that intuition you need to have. Right. Inference. Inference basically means coming to your own conclusion, listening to something, understanding to something, and interpreting. Okay, this is the implied meaning. Okay, some questions will be asking you why the person is saying this. Okay, is it a warning, reassurance, criticism? So that identification of the purpose, the tone of the speaker, that skill you need to have. Recognizing changes, that is from positive to negative, negative to positive. If there's a sudden change in message, that ability also is very important. And very importantly, as I told you, mental stamina. Okay, you're doing 42 questions continuously. Okay, and you're doing several things at the same time. You have to listen to the audio, same time you have to read the question, same time you have to choose the correct answer, and you have to do everything under a pressured situation, in a high pressure situation, and you have to stay very calm and focused as well. So you need to train yourself to manage your cognitive load. There are different types of questions: opinion type questions, purpose type questions, inference, detail specific. So this question that we did, this question what we did is a detail specific question. What he noticed. Okay, so what specific point does the speaker make? So that is the question that we just did right now. Attitude questions will be there. Speaker agreement, disagreement, that is usually for reading part B, listening part B. And these are the common mistakes. So there is no need for you to understand everything. Just give importance to the keywords and the verbs over there. Understand that, comprehend the verbs especially, have a clear idea what your duty is, and then try to pinpoint the correct answer. Okay, and again, the same, no, see, in the wrong answer options, the same word will repeat. Okay, but that is a trick by OET. That is often a distractor. So don't mash the vocabulary, try to grasp the meaning. Okay, so there is no shortcuts here. You definitely have to understand the meaning of the written information as well as the information that you're hearing in the audio. Okay, and when you get stuck on one question, you have to move on. Okay, so they, as I told you, you will make some mistakes. So when you make a mistake, don't get stuck onto it. Accept that you made a mistake, forgive yourself, and just move on. Okay, that confidence, that level of confidence is very, very important. Okay, misinterpreting the speaker's tone, that is misjudgment of the tone and purpose. And more importantly, not reading the questions properly. So when you get the 90-second time, you got to use it very nicely. Okay, so train yourself according to what is important. Right, so that is the session, end of the session today.